Premier Doug Ford says he will release new modeling early next week, possibly Monday, and clearly indicated more restrictions are coming as he held his grimmest news conference yet.
This is going to get out of hand. I just can't stress it enough. Please, please, just follow the protocols. We're in a desperate situation, and when you see the modeling, you'll fall off your chair.
The underlying tone during today's news conference was fear.
Today's numbers are, to be frank, they are scary.
It's not just the rising COVID cases causing concern, it's the impact on the healthcare system that is facing unprecedented pressure. Ontario Health is estimating 500 people will be in critical care beds in just over 2 weeks.
It means that in huge numbers, people's access to cancer care, cardiac care, other life-saving care, other care that is needed to maintain or improve one's quality of life, all of that will be crowded out. So you'll see a colossal amount of unnecessary death and suffering.
Do you see a point where we saw in Italy, New York, for example, other regions, where people who are very critical may not get any care because they would have to take care of those who have a better chance of survival? Are we looking at that?
I think it's probable, yes. I think in some parts of Ontario, we're probably looking at what's called in healthcare a code orange, which is kind of overwhelming conditions that require a different emergency approach to providing life-saving care.
Those grim scenarios have the government warning stricter measures are coming to Ontario, maybe even a curfew. Epidemiologist Colin Furness believes that would be impossible to enforce.
Mass testing is way better than lockdowns. Some fraction of 1% of our population has COVID right now. The other 99-point-something% don't. So why would we want to lock up 99-point-something% of the population? Because we're unwilling to do some simple things to identify the less than 1% that need help. Doesn't make sense.
The opposition is calling out the government for not acting immediately. But a spokesperson says more time is needed to assess the impact of the province-wide lockdown that went into effect 2 weeks tomorrow. In the meantime, hospitals are being told to prepare to transfer or receive patients where beds are available, and some are running out of vaccines. The next shipment of 80,000 more Pfizer doses is due next week. It will be months before vaccinations will make a significant difference.
We need to hang in there till April, May, June. Those are the crunch months that we'll be able to do mass vaccination. Premier Ford made a plea to Health Canada today to approve the AstraZeneca's vaccine.